Okay, in this video I'm going to show you how to get a DOT physical for your box truck. It's one of the easiest things you can do, one of the easiest part of the process. Um, what you do is you go to Google and type in DOT physical near me, and it's going to pop up doctors that do DOT physicals in your area. Okay, so what I would recommend you do is look at the reviews. This one has 369 reviews, and they're all 5.0. This one has 566 reviews, and they're 4.5. Okay, this right here, it says urgent care. It's probably a hospital. This right here, all they do is DOT physical. So always look for the reviews, because that means when people are happy with the reviews, that means that it's an easy process. The doctor gets you in, gets you out in no time. So always look for the reviews. If you see something with 3 point something or 4, look for something that's better. The better the doctor is, the easier it is. People are going to run to Google and they're going to let you know, okay? The one I did, I think it was Northeast Ohio Physicals. And if you scroll down, they do them in CVS. That's a pharmacy. But as you can see, I paid $79 for the Cleveland area. I'm in Cleveland, Ohio. So it was only 79 bucks. This can vary. It can be 79, 75, up to like $125, man. It's not even that hard. So what I did is, well, let me go to the reviews. Click more places so you can read the reviews. Let's see, we'll do this one. This is the one I went to. It's got 5.0, all five stars, 369 reviews. Go to the reviews and it'll tell you everything to expect. Great personable service, efficient and quality. Great experience, great doctor, great prices. Everything was amazing. Excellent place, pleasant place, in and out in a half hour. This is what you want to see. I was in and out myself in 30 minutes, but the doctor was actually booking appointments while I was in his office. So I could have easily been out of there in 10 or 15 minutes. But, like I said, he was booking his own appointments, and that's why it took a half hour. Very pleased with the ease of scheduling. Dr. Monroe is very polite, professional, knowledgeable guy, easy to work with. He advised me ahead of time what to bring and what documentation. Yeah, they'll tell you everything you need. As soon as you call to book your appointment, he's going to ask you, do you have like diabetes, high blood pressure, and a couple other questions. And, so if you answer them that you have diabetes or something, he's going to tell you exactly what to expect, what you're going to need. If you have diabetes, you can still get your DOT. The only difference is that it's only good for 1 year. A regular DOT is good for 2 years. This one, if you have diabetes, it's 1 year. If you have high blood pressure, you can still get it for a year, but you might have to get a letter from your doctor saying that it's controlled under medication and that you'll be okay. So it's not impossible. It's a little bit harder, but you can still get it. So look at the reviews. If the reviews are good, then go ahead and do it. Like I said, I paid 79 bucks. What to do when you go there? What they're going to do is you're going to go in there, you're going to go in the lobby, and you're going to fill out a questionnaire. The questionnaire is going to ask you questions about your medical history. Have you ever had heart surgery or any kind of surgery? Diabetes, high blood pressure, cholesterol. It's going to ask you a lot of questions, and that's going to be it's going to be the biggest part of the exam. So what you do is you go through, you answer every one honestly, and once you fill out your questionnaire, once you get to the back, the hard part is done. When you get back there, he's going to put he's going to check your blood pressure. He's going to put that thing on your arm that they blow up with the little balloon. He's going to check your heart rate. He's going to check your eyesight. So if you have glasses, you need glasses, wear your glasses. He's going to ask you, to read some letters, and then he's going to ask you to drop some urine. Now the urine is only to check if they have blood in your urine or high sugar. That's what they check, diabetes. So they don't do drug testing at all. They don't pull hair, they don't pull blood, and they don't test for any kind of drugs. This is for a box truck. It's non-CDL. It's not required to do this. So they'll check your urine. He'll go in the bathroom. He'll check for, like I said, for blood, which is usually from bad kidneys or from a UTI, urinary tract infection. So if you have any of these, you probably would have went to the hospital before you even took your DLT. So you should be fine. And after that, after that, after that comes clear, he'll sign you a piece of paper, and then he'll laminate that paper. He'll put it in plastic, so in case so it doesn't get wet. And what you do is just fold it up, put it in your wallet, and it's good for 2 years. And then he'll call you maybe like a week before it's due in a couple years, and you go right back and you renew it. You have to renew them every 2 years. So remember, let me go over everything you need to do. Google DOT physical near me, and look at the reviews. This one has 369 Google reviews, 5.0, all 5 stars. That means the drivers are telling you, these are truck drivers, box truck drivers. They're telling you, hey, come to this guy. It's gonna be quick and easy. If it was like one of those, if it was hard, you'll see a lot of bad reviews. So that's what you want to do. This one has a 4.5, which is still good. But this is, like I said, this is the hospital. They probably have different reviews for different stuff. This one says it went for DOT physical. This one, not sure if that's a DOT, but it's got a low review. Definitely don't want to go there. It could be a long wait, it could be a hospital. This is urgent care. Let me show you this guy's website. This guy has a website. Look, all he does is DOT physicals. And the thing about this guy, he was a chiropractor. He wasn't a regular doctor. He wasn't a surgeon or nothing. He was just a chiropractor doing DOT physicals. $79, cheap. And then he took the calls himself. This is the guy that I saw. This is how they take your blood pressure. All he had was an office. It was like it was the size of a jail cell or something. It was so small. He has a desk. He had a printer in there. He had this in there, and then he had like a spine because he was a chiropractor. I guess he cracks backs or something. And that was it. 5-point reviews. Outstanding experience. I mean, these are all truckers, box truck drivers and semi-truck drivers. So look for the reviews. Go ahead and get it. It's not that hard at all. And you'll be in and out. Let me see. Preparedness checklist. Sometimes I'll ask you a couple questions of, before you go. This one says driver's license, medical card if applicable. He didn't ask me for no card. Eyeglasses if you need them, wear them. List of medications if you have them. Diabetic. Bring your most recent A1C reading to your physical. I think that's when you check your blood sugar. History of heart surgery, heart attack and stuff. So if you have heart problems, diabetic, all you need is a letter from your doctor saying that it's in check with the medication and that you can do it. And then they'll give it to you for 1 year. If not, it's a 2-year process. Real simple stuff. All right. If you guys have any questions, just let me know. Hit me up.